Hi everyone, I'm Alberto Galasso. I'm a professor at the Rotman School, that is the business school of the University of Toronto. It's April 2020. I'm close at home uh, because of the coronavirus outbreak. A number of my seminars and conferences have been canceled. So I decided to take this as an opportunity to develop and post a short seminar video on one of my recent research paper. This is joint work with Hong Luo at Harvard Business School. The title of the paper is Risk Mitigating Technologies, the Case of Radiation Diagnostic Devices. And last month, the paper was accepted at Management Science, so it's forthcoming at Management Science. I would like to start by showing you three pictures. So the first picture is a famous one, is construction workers in New York. The second one is a picture of a woman driving in a car with two children. And the third one is a ski resort in the 60s. Okay? Why I show you this picture? The message here is that risk perception can change dramatically over time. Things that today we think are risky and not safe may not have been perceived as that risky in the past. Okay? So risk perception may change because new information is revealed, for example, through accidents or scientific discovery that receive their media attention, and the information becomes disseminates in the economy, and that in that sense then people revise their perception of risk and safety. In this paper, we ask the question whether or not can a big change in consumer risk perception affect the rate and direction of technological change. We think this is an interesting question to examine because health and safety concerns are of first order importance from a welfare perspective, from a social perspective, but also from the managerial perspective, from a more private perspective. Failures of technologies that generate harms to customers may be very costly for firms, as they may lead to expensive product liability litigation. Product liability litigation accounts for a large fraction of litigation in the United States. And moreover, especially these days with the internet and social medias, accidents receive large media coverages. Think about the coverage of the Boeing 737 accident of Uber's self-driving car accident. This extensive media coverage can have very big effect in terms of inducing customers and consumers to revise their risk perception. The key idea in the paper is that an increase in risk perception may serve as a demand pull force for innovation, may induce firms to innovate more, in particular to direct their innovation efforts toward a particular type of technology that we're going to call in this paper risk mitigating technologies. Risk mitigating technologies are technologies that reduce the probability of negative events and or the severity of their consequences. The first thing to notice about risk mitigating technologies is that they are very common type of technology. So even in the room where you are now watching this video, probably around you there are fire extinguishers or fire alarms or other technologies that are there to keep you safe. The second thing that I would like to point out is that there is something conceptually different between improvement in safety of a product and other type of quality improvements of a product. So to make this point, let me kind of introduce some kind of the simplest way in which economists think about innovation. They typically think about innovation as distinguishing between two types of innovation: product innovation and process innovation. So product innovation is an innovation that increases the kind of quality of a product by increasing the willingness to pay of consumers. So it typically hits by having an effect on the willingness to pay of consumers. The other innovation is the process innovation that is instead about a reduction in the cost of production of a particular product. So it creates more surplus by reducing the cost of production. So to think about safety requires extending this simple model in two dimensions. First of all, you need to think about quality as a multidimensional thing. So there is, one dimension of quality, we can call it theta S, is safety, but there are other dimensions of quality. So for example, if you think about a car, you have the safety of the car, you have the comfort of the car, you have the speed of the car, and so on. Then when we think about the cost, we have to distinguish between the cost of production, the manufacturing cost, and the cost generated by product liability litigation. So with some probability rho, a product can fail and injure a customers, and this may lead to payment of damages. And as you can see, this rho D, that is the product between the likelihood of failure of the product, the likelihood of an accident, and the damages that you have to pay, enters more like the marginal cost of production. Now, if I innovate and I create a safer product, then what is happening is that both, the safety of the product in terms of perception of customers for safety increases, and the cost associated with liability goes down. So it increases theta S and reduces rho D. So the point that I'm going to make is that innovation that involves safety inherently possesses feature both of product and of process innovation. Okay, automatically kind of increase the willingness to pay of customers and also reduce the cost for the firm, in particular a specific type of cost, that is the cost associated with product liability litigation. So from that perspective is a kind of a hybrid between the two typical views, two typical classes of innovation investment that in economics of innovation we typically consider. Moreover, more from the management perspective, if you think about what drives the value of a risk mitigating technology, the drivers of economic value tend to be unique compared to innovation that increase other type of quality dimension of the products. An innovation that increase safety as a value that depends on things like the product liability system, the tort system, regulation in terms of safety in the industry, the efficiency of insurance markets, how much in that industry accidents are picked up and discussed in medias and so on, that are kind of unique drivers of economic value for these technologies. So to summarize, from the theoretical perspective, what we argue in the paper is that an increase in risk perception, so if there is something that makes users and consumers perceive products as less safe, generate a shift in the demand that is associated with an increase in the willingness to pay for safety. And this can be an important incentive for innovation for firms. It may push firms to direct their innovation incentive toward risk mitigating technologies. And if this effect is strong enough, total innovation activity in the technology area may actually go up. Okay. In the paper, we also discuss, what are the kind of boundary conditions? What are the conditions under which we expect this not to happen? And a few things need to be pointed out. For example, this may be not happening if there are major substitute categories of products that consumers can immediately switch to if one category is considered unsafe. Okay, so if, for example, cars are perceived as much less safe because of something that happened in the industry, people should not be able very quickly to just replace cars with motorbikes. Second, there should be technological opportunities. So it should be possible from a scientific perspective to improve the product and make improvement in terms of safety. There should not be kind of limits in terms of physics that make it harder to improve that dimensions. And finally, as we point out in other research of ours, there should not the shock that it changes the risk perception of customers should not be associated with an increase in uncertainty in terms of law or regulation in the industry, because that one may also chill innovation investment by firms. The empirical setting that we use to test this idea is the radiation diagnostic device industry. In particular, something that happens in California at the end of 2009. So in October 2009, in a medical center in Los Angeles, about 200 patients that receive all sorts of tests came back to the hospital complaining that they were losing hair. They had hair loss problems. So the hospital investigated that. They realized that all of those patients had a CT scan. They all went through the same machine, and they looked at this machine and they found that the machine essentially had its setting changed. So one of their technicians changed the setting. So these people essentially received more than 8 times the normal level of radiation. Okay, we're talking about machines that emit high levels of radiation, so this was quite a big thing. And initially this was discussed in the local medias, but then a journalist of the New York Times, Walt Bogdanich, learned about this and wrote a piece toward the end of 2009 called "Radiation Overdoses Point Up to Dangers of CT Scanners," discussing how this technology may not be as safe as we perceive them to be. The article had a lot of attention. It was shared a lot in social medias, discussed in a number of platforms. So the journalist doubled down on this topic and eventually wrote more than 20 articles in the New York Times. And this was accompanied by a lot of other articles in other journals and discussions in other medias. Eventually, in 2011, Bogdanich was even named as one of the Pulitzer Prize finalists because of his research on medical radiations and the danger associated with these devices. So if you talk with people that from the industry, you see that they definitely tell you this was a big shock. It changed substantially the perception for this type of technologies by possible patient, but also by doctors and hospital administrators. There were surveys done trying to capture the risk perception for this type of technology before and after 2009-2010. You see also there big differences in the responses. Before the shock, there are surveys that show that about 75% of physicians tend to underestimate radiation dosage, and 10% of the doctors and only 3% of the patients reports that there is some link between CT scanners and possible cancer risk. After the shock, these numbers are very different. There are surveys that show that only 25% of the doctors seem to underestimate radiation dosage. The vast majority of doctors and many more patients start believing that there is some kind of link between CT scanners and cancer. People from the industry, our discussion with people from the industry also suggests that this was a big change in the mindset of radiologists. Before the shock, their main concern was image quality. They wanted to see stuff essentially in the best quality as possible. After this coverage, it was much more a trade-off between, what is the extra amount of radiation that I need to improve the quality of the image. The other thing that I want to point out is that for this particular accident in the hospital in Los Angeles that involved a technology, a machine from GE, there was nothing wrong with the machine. There was an FDA investigation documenting there was essentially an error by a technician. There were attempts of class action lawsuits against GE. They were rapidly dismissed because the machine was working exactly as it was expected to work. So the technology itself was totally fine. The shock just generated a big increase in the perceived risk by the public on the use of these technologies. So we studied this and empirically using a variety of data sets and a variety of approaches. We start with patent analysis. Here we focus on the very detailed classification system of the patent office, of the American Patent Office. So we look at the patents that belong to a particular group called A61B6. That is a group in which the American Patent Office puts all the patents that are related to radiation diagnostic devices. Now, within this group, they are classified in very detailed technology subclasses. There are 140 subclasses in this group. And we try to identify the subclasses that are related to features of radiation diagnostic devices that are about mitigating risk. Okay, particularly we identified 8 subclasses by looking at the title that really seem related to reducing the risk of radiation. They have titles like protection against radiation and so on. So our analysis from the patent perspective is mostly about comparing patenting activity in these subclasses that are more related to risk mitigation compared to other type of technologies and radiation diagnostic devices. This is robust to using a more sophisticated approach to identify risk mitigating technology classes by looking, for example, at the text of the patents and using a textual analysis algorithm and classify each patent as a risk mitigating technology or not, depending on whether the words there are related to mitigating the risk of radiation, and classifying a subclass as a risk mitigating subclass if enough patents in that subclass are about mitigating the risk. As you can see from a simple plot of the data, patenting in risk mitigating technology subclasses tend to increase substantially after 2010 related to patenting in other subclasses of radiation diagnostic devices. This is there not just with simple graphs. We can show that in a number of difference in differences regressions. The magnitude of the increase seems large. It's about 110%. So patenting activity in patent subclasses related to risk mitigating technologies increase after 2010 relative to other patent subclasses in radiation diagnostic devices. The increase goes up over time, as monotonically increasing over time. And in the paper we discuss a lot of robustness checks. So this is robust to using alternative econometric specifications, focusing only on CT patents, for example. But we present there a number of tests that show that the results is quite robust. One thing that you may consider as a possible issue in terms of interpreting the result here is that this increase in innovation may simply be driven by a substitution. Okay, so some of these big medical device producers, they reduce their innovation investments in components of the product that are not related to safety and increase the innovation investment and the patenting activity in components of the product that are related to safety. So in this case, it's not that total innovation activity goes up, it's simply a substitution, okay, a change in direction in innovation activity without an increasing natural level of innovation activity. So we do something to try to understand whether it's just a substitution effect or there is more an increase in the level of innovation. And in particular, the way we do that is to use different type of control groups that for which we expect substitution to be less likely, okay? So we do this in two ways. We look at technologies that are more distant from radiation emitting devices. So rather than comparing patenting in risk mitigating technology of radiation diagnostic devices with patenting in other features of of radiation diagnostic devices, we compare patenting in risk mitigating technology of radiation emitting devices with patenting in non-radiation diagnostic devices, or even further technological areas like medical implants. Okay, we go also one step forward. We do this by dropping from the sample largest players that can patent on both technology areas. Okay, so when we do this, we still find a large positive correlation, a large positive coefficient in the difference in difference. The magnitude is a bit smaller, suggesting that there may be some substitution, but is not big enough to really kill the result. The second analysis that we do look at an alternative data set. Instead of patent data, we look at application to the FDA for the commercialization of new devices. So here you can think about the innovation process. We are closer to the end of the innovation process. We're really closer to the commercialization of a new product compared to patents that are more upstream in the innovation process, more at the early stage of the research activity. Moreover, if you think about FDA application, here we're really talking about full products, whereas patents are more about the components of the products. A single product can be covered by a lot of different patents. So what we find here is that application for radiation emitting devices go up after 2010 relative to other medical devices. This seems to be driven by the devices that emit the larger amount of radiation, okay, something like CT scanners, and not by devices that emit only low radiation, like for example these devices that you find when you go to the dentist, right? Secondly, we actually look at the text of the application to the FDA, and we find that this seems to be driven by application that actually refer to dose of radiation in their first page, in the summary of the application, and not by those applications that do not refer to radiation dosage. This kind of suggesting that there was a kind of increase in commercialization and development activity of new products after this shock, especially for products that emit high level of radiation, and led to new products that seem to kind of address this idea of radiation. Looking at this FDA application, in particular focusing on those for CT scanners, we did something more in the paper and really tried to document what type of technology were developed, what are really these new technology that were developed after the shock. We find a lot of variety there. In particularly, we find what in the innovation the management of technology literature you call incremental technologies. So those is kind of minor tweaks of the product, something like new software codes that make it harder for technicians to change the settings. But also find like much more substantial, much more radical type of innovations. An example of what we think is the most important here, new technology that was developed, in particular pushed heavier after the shock, is the what is called ER method, the iterative reconstruction method. That is an alternative method of constructing the image in a CT scanner that uses much less radiation compared to previously used methods. We look at whether this increase in innovation activity that we find is driven by the largest players in the industry or is driven by smaller entities. And here we distinguish between the top 5 firms in the industry, that are GE, Siemens, Toshiba, Philips, and Hitachi, and the smaller players. And what we find is that if you look at the patent data, you see somehow an increase in both innovation by the bigger player and also by the other firms in the industry. But if you look at application at the FDA, most of the actions seem to be driven by the largest firm. So in the paper, we discuss this quite in detail, provide reasons why we expect this to be the case, why we expect larger companies to have somehow an advantage in terms of commercialization and development of new technologies. In this, especially when we're talking about convincing hospitals to adopt technologies that are safer. From the point of the patenting perspective, the fact that you see an effect also for other players suggests that there is a market for technology there, active and in place. So even if you have a disadvantage in terms of commercializing and developing and producing a technology, you can still be active in terms of innovation and licensing it to the bigger players. The final thing that I want to show you is it relates to our theoretical mechanism. Okay, we thought about this as a shift in demand, right? The change in risk perception generate a shift in demand. Consumers are more likely to demand safer products. We wanted to find direct evidence of this demand shift, and we were able to document in this using 2 different data sources. First, we have data from the FDA on installment of new radiation devices in hospitals and clinics in the United States. Second, we have data from Medicare on actual exams that are done that involve radiation. What we find is somehow an opposite effect on installment of new and equipment and install of new machines and usage of the equipment. Okay, hospitals and clinics seem to install more CT scanners after the shock relative to lower radiation machines like chest X-ray machine or dental X-ray machines. At the same time, though, we see a reduction in the number of high radiation exams, high radiation procedures after 2010 compared to either procedure that emit low radiation or other medical imaging procedures that emit no radiation like MRI and ultrasound. So it's a kind of opposite effect on the intensive and extensive margin of demand. And we discussed this in the paper. This type of different effect on the intensive and extensive form of demand can be explained by a change in risk perception. If you think that a technology is less safe, you're more likely to replace it with something that is safer, but also you may be less willing to use it even after you replace it. And this, is something that is not so natural to find for shocks that involve other type of quality dimensions. Okay, there are a few takeaways from our study. The first is that changes in risk perceptions can be an important driver of innovation investment. In particular, they can push firms to direct their innovation activity toward this technology that in the paper we define as risk mitigating technologies. The second thing that we find in the paper is that large firms can play an important role in developing these risk mitigating technologies. Product failures of large companies not necessarily are going to lead to big losses in market dominance and innovation activity by these large companies. They can also generate some leadership activity by these companies in development of these risk mitigating technologies. The final point that I would like to make is that, even if in this paper, in this setting, we describe conditions under which there can be a big positive increase in innovation activity, it's important to remember that this is not necessarily the case. There are boundaries conditions out there. And more generally, that the link between safety perception, product liability risk, and innovation is quite complex, and there are many trade-offs involved. Hong and I have a number of papers on this. We have a companion paper, for example, showing a different shock in the medical implants industry, showing the opposite effect, which innovation actually decreased dramatically after the shock involving accidents related to these products. So what is the bottom line? I think that compared to other areas of economics of innovation, we don't have as much empirical evidence on the link between safety perception, the role of damages the firm have to pay if their technology fails, and innovation investments. So this is definitely an area that is worth considering for future research activity. Okay, so this is what our paper was about. So thank you so much for your attention.